Sorry. I mean, she's basically mooning me.
Or punking Dr. Choi. Hello and welcome back to DocTalk, where we talk about what we know you're talking about with a doc. Dr. Janet Choi. I'm Lissa Klein. Our stats tell us that so many of you are looking at our instructional video on injecting progesterone in oil. And so you may have found that video today because you're planning to inject progesterone in oil this evening or this morning, whatever your timing is. And so wanted to have even more information for you to have about your injections. And I was asked before we started this if I would give an actual demo. I thought someone was going to have to inject me with progesterone. We're just going to simulate it. So progesterone in oil is a shot that happens in the tush.
Yes.
Dr. Choi, would you like to demonstrate?
So I usually will draw circles to help the patient or the patient's partner aim. Sorry. I mean, she's basically mooning me.
Or punking Dr. Choi.
So typically when I'm in the office with the patient, I will take a pen so they can know where to aim. And I'll say, pretend once you go to do this shot that you're aiming for the upper outer corner of your jean pocket, right?
Here.
So it'll be here
Yep.
or here.
Yep.
And so I'll draw circles, it doesn't have to be exactly in that same spot, and then give them a place to aim for.
Yep.
Or their partner or their friend or their family member to aim for.
Yeah, some people can do it themselves too.
Yeah, I remember I had one patient literally say she was able to do it. I mean, it takes a little bit of flexibility, but she did it.
Yeah. So that's where you should inject your progesterone. Talk to your own care team at your clinic.
Please.
But typically that's what's recommended. And you can, as Dr. Choi mentioned, have your nurse or your care team at your clinic draw a circle, non-toxic pen, draw a circle.
Not a
and
Sharpie.
Yes, exactly. And that'll help you too. Okay, so we're gonna jump right into progesterone in oil.
Yep.
What it is, why you have to do it, why do you have to give yourself an injection every day? Not fun. And so we know a lot of you really wonder why progesterone in oil is often, not always, but often recommended when someone's going through fertility treatments, whether that's IUI, IVF, or others. And so we're going to answer the most Googled questions about progesterone in oil. I hear questions a lot like, does it hurt? Are lumps and bruises normal? What happens if the progesterone level remains low, like at the blood test? And whether you're in the middle of fertility treatment, considering it, or trying to become pregnant on your own, we know people are curious about it. And so I'm excited about this one, talking about progesterone in oil. So I'm just going to rapid fire talk to a doc.
All right, I need
You
to
ready?
get ready then, yeah.
Get in the progesterone in oil.
Yes. Speed dating around progesterone in oil. Right?
It's often called PIO, progesterone in oil. And so what is progesterone in oil used for?
So progesterone in oil is used frequently in conjunction with certain fertility treatments, as you already alluded to. And so progesterone itself, the hormone, is made naturally by our bodies after we ovulate.
By the corpus luteum.
By the corpus luteum, which is a little spot in your ovary. And progesterone is a very essential hormone to support that phase post-ovulation until you get your next period, in case you do get pregnant. Because that early pregnancy, if it happens, and that's desired, that progesterone helps that pregnancy start to travel down and then implant into the uterus and grow. And that's also the luteal phase. So if you don't get pregnant that month, whether attempts at home or with medical treatments, the progesterone levels naturally fall after about 10, 12, 14 days post-ovulation. That shakes loose your uterine lining, and then you get your period, and the whole cycle starts all over again. I love that TikTok, by the way, where someone was asking about the luteal phase. The luteal phase, that's predominantly progesterone controlled.
Yeah, that's usually the second half of a menstrual cycle.
Exactly.
Most people's menstrual cycles are 28 days, so that's second half post-ovulation. What does progesterone do once it's been injected, and how does it specifically help with an embryo transfer?
Great. So back to the treatments. Let's say you're doing an embryo transfer, and your doctor wants to make sure that you get adequate progesterone support, depending on the protocol your doctor has you on. Whether it's natural, semi-natural, programmed. In most cases, they might want you to have some extra, just like a little oomph of extra external exogenous progesterone. Typically for programmed FET cycles, when your own hormones are completely suppressed, your doctor wants a real oomph of progesterone in your system, so they may, depending on their preferences, prescribe progesterone and oil to ensure that you're getting really regular, decent doses of progesterone into your system at the crucial time post-transfer.
So supporting the pregnancy.
Just try to support that, hopefully that embryo that's trying to embed itself and create a pregnancy for you.
And are there alternatives to progesterone and oil?
Absolutely. So some patients, when they shift practices, they get a little upset because they're like, I used progesterone oil last time. And I was like, yes, but you're on a new practice. And these providers might feel more comfortable using, there are like progesterone capsules, like Prometrium or endometrium, and then progesterone, other substances like that to try to help support the luteal phase, in addition to potentially trying progesterone oil. So they're all equal alternatives, in my opinion. And so if your new doctor doesn't use it, doesn't mean that they're doing something wrong.
How long does one typically take progesterone and oil?
So typically you'll start taking it right around ovulation time or the day after or two, and then you'll be on it through the transfer. And then typically your first pregnancy test is going to be 8 to 9 days, 9 to 10 days after your transfer. So you'll be on that progesterone at least until that date. And then hopefully if you are pregnant and have a positive pregnancy test, your doctor will likely have you stay on that progesterone oil until you're 6, 7, 8 weeks pregnant, depending on what their protocols are.
And at some point, the placenta starts creating that progesterone, right?
Absolutely.
And sort of takes over.
Exactly. And so there actually have been studies done showing that the placenta takes over fully in naturally conceived pregnancies from the corpus luteum production at around 7, 8 weeks gestation.
Yeah. Okay. Perfect. Is progesterone and oil safe?
Yes, it is. I know, because sometimes I've had patients, call me, ask my nurse team, and say, I read the labels about progesterone that says don't take it if you're pregnant. And so we have to talk them off the ledge and say, obviously, we are all here to support you and help you get pregnant. This has been used for many decades safely to try to help promote fertility and family building.
Yeah. What are some side effects of PIO or progesterone
So
and oil?
progesterone itself, and you may notice this if you have menstrual cycles and in the luteal phase post-ovulation, you start to feel more cranky, more sleepy, more hungry, more hangry, more breast soreness, more bloating, and this can be really tricky because sometimes these are the same symptoms of early pregnancy. People who are on progesterone oil, they can have symptoms that range like that to almost nothing at all. At the injection site, because that oil is a little bit thick, it's not watery, so it doesn't disperse as quickly. People can sometimes develop these little lumps or knots under their skin at the injection site. They're typically not dangerous or scary. I encourage patients to try to gently massage them away. It takes a while sometimes. Very, very rarely, those injection sites and lumps can get infected, but we're talking really rarely, like less than 1% of the time. And again, super, super rarely. This more has to do with the injection needle. Sometimes people can actually nick a nerve, and that can cause some numbness and tingling in their leg, but typically that's temporary and resolves, and again, super, super rare. At the same time, I think it's very important for you to stay informed, so it's really important for you to go over these concerns and symptoms with your care team.
And what about allergies? If someone has a peanut allergy or these other things, how should they think about PIO?
So number one, make sure that your care team is very well aware before you start any kind of medication regimen what your allergies are, and also remind them constantly you have to self-advocate. But make sure that you definitely tell them about any kind of nut allergies, because typically progesterone oil is made at the pharmacy, these fertility specialty pharmacies, and they suspend the progesterone in peanut oil. If you have a nut allergy, they can actually suspend it in things like sesame oil.
Yeah.
And I think
Or
I've seen olive
oil.
oil,
Yeah.
right? And so there are alternatives if you're allergic to one substance, but you need to let your team know.
Yeah, and if you don't know you have a nut allergy or any type of allergy and start having like a rash or hives or anything like that, that would also be something you tell your doctor.
Absolutely. So anytime you're on these medications, these hormone therapies, progesterone oil included, if you start getting all these symptoms like Dr. Lissa said, don't ignore them. Just make sure you call your care team. Make sure it might be a good idea to have some Benadryl handy at home just in case you develop an allergic reaction.
And I didn't say this at the beginning, but I think it's helpful to talk through. When we're talking about progesterone and oil injections, we're talking about IM or intramuscular injections. And so that's the one in the tush where we talked about where it's going into the muscle and the needle is slightly bigger.
Yes.
As opposed to subcutaneous, which is that teeny tiny needle that you see often.
Absolutely.
And so you'll see it'll be a shift if you've been injecting yourself within an IVF cycle.
So don't be taken aback then, right?
It's a little bit different. let's see, do they hurt? Do the shots themselves hurt, and are they uncomfortable?
Well, by a skilled administrator like yourself, no. Sometimes they can hurt, and so I think, I'm just being very honest, but again, with proper training and preparation, people tolerate them well enough. Again, no one likes jabbing a needle in their butt day after day after day, but it's tolerable.
Yeah. Some people recommend like a warm compress to sort of relax the area. They have those, not Theraguns, although that might work too, but those like they're the little balls that you rub.
The muscle balls to rub in the area?
Yeah.
That's a good idea.
Yeah, stuff like that.
Sometimes we'll tell people to use like heat pack and just kind of warm up that area, pre or after the shot.
Yep.
And the other really important thing, I don't know if we got to this yet, is just make sure you don't stick that progesterone oil in the fridge when you get your medication shipments. Otherwise, if you can talk to your Progyny PCA if you have questions. Make sure you double check with them or with your pharmacist in terms of where to store them, because it really should be at room temperature.
Yeah. What do you do if you miss a dose? Besides freaking out.
Yes,
You'll
one,
freak
you
out.
don't freak out. And two, then just take it when you remember.
Yeah.
And then you can always, if you have any further questions in the morning time, just when the office opens, just consult with your care team and say, do they want to make any other changes? But again, it's not like your HCG trigger shot or Lupron trigger shot where you have to take it at exactly the right time. You have some flexibility with the timing of this. So if you normally take it at 8 p.m., but like one day, you take a nap and you wake up at midnight and you're like, oh my goodness, I'm 4 hours late, totally fine. That actually is not freak worthy. I would just do the shot then.
Yep, I like the advice too to talk to your doctor if you're concerned. I see this a lot and hear this from people who are on progesterone, whether they are spontaneously pregnant or unassisted or through fertility treatments, where they got a blood test back and their progesterone is low and they're freaking out. One thing I think it's important to note, tell me if this is right, that the progesterone level in blood through venipuncture, your progesterone is a pulsative hormone. So it ebbs and flows throughout the day. So it's high, low throughout the day. It's not steady and consistent. And so that could be some of what people are seeing. Is that accurate?
Exactly. And so keep in mind, the blood test tells you one thing, but what's more important, and we have a less of an accurate window into through the blood test, is we want to just make sure your uterine area is getting bathed in progesterone. And there have been studies done over decades of research that have shown that, even if your progesterone levels seem a little low, your uterine cavity is actually getting adequate amounts of progesterone, which is why, for instance, if your doctor decides to give you progesterone suppositories, your levels may even be lower than when you're on progesterone oil, but you're still getting adequate luteal support. Again, sometimes your doctors will look at your progesterone levels and make some tweaks and adjustments as well, which is also quite appropriate. And again, if you have any questions, you should always just talk to them.
Yep, talk to your doctor. If you're really freaked out by needles, I think most people overwhelmingly get through it. But there's also sometimes options, depending where you live, to have nursing teams come to your home and help with the injection, and that might allay some concerns too.
What I've had some patients do, especially if they're on their own, is sometimes they'll hire a nurse just for the first couple of days or nights, kind of to, one, get them over that fear hump, and then also help guide them and teach them how to self-administer the shots. And then they find they don't need any extra help after that.
They become pros.
Yeah.
Some of the logistics stuff, you already mentioned progesterone oil should not be refrigerated.
Exactly.
If you think about putting like oil in the fridge, it will become thick and goopy, and you don't want that. Does it expire?
It does, and typically I have to talk to I always ask the pharmacist. I think it expires after a month or so, but again, that's a question to raise to the pharmacist, and typically they'll say on the box like when it expires.
Yeah, and you'll typically get, if you need extended progesterone, a few different bottles.
Right.
Yeah. What is the cost, and do you know from your experience with your patients, is it often covered by
Depends on
insurance?
the plan that they're on. I mean, obviously if you're on Progyny's plan, it's all covered. Cost, it's not, we're not talking thousands of dollars, but I think a 2-week regimen, don't hold me to it, from what I recall, is probably in the hundreds, like $150 range for a bottle. That'll last you 10 to 14 days. So again, it's not inexpensive, but it's not like, $1,000 for an FSH pen or something.
Yeah, some of these other medications are quite expensive, and this comparatively is slightly less. Check with if you don't have Progyny. If you have Progyny RX, it's a covered medication. If you don't have Progyny RX, check with your pharmacy coverage. And sometimes you might have coverage for like generics versus name brands, although I think these are all generics. Yeah.
Important tool in the toolbox of all the fertility treatments and medications. Not always used, but sometimes. And there's good reasoning behind why doctors will use it in certain instances. So.
Yep. So talk to your doctor if you have other questions. If you are waiting to inject yourself tonight, good luck. We're rooting for you. You're going to do it. It's going to be fine.
You can do it.
You can do it. And as always, we love doc talking together.
Yes.
And we love doc talking to you. If you have specific questions or things you'd like to know more about,
write it in.
Yes. People don't write anymore, they type. But yes, yeah, type it in. And
Wait, is it like DM us?
Yes.
Slide a DM to us?
Exactly. So that wraps our discussion of the most Googled questions around progesterone and oil.
Most Googled questions.
Yes,
Yay.
we love talking to you about the things we know you want to hear about. We know that this all can be overwhelming, especially injecting yourself with medications. There's so much writing on it. It's so anxiety provoking. So I'm glad we were able to talk about it.
It is safe. So, yes.
It's safe. Yeah, you're good. You got this. Bye.